at the AAD, I gave several presentations, including 2 late breakers. One was on the ADVICE study that was a study done with 2 doses of Etrasimod, 1 milligram and 2 milligram, that were taken against a placebo. Relatively a small study, a phase 2 small study. Etrasimod is an S1P antagonist that S1P modulator that is now also in studies for ulcerative colitis. It's in phase 3 studies. And this is a novel mechanism of action that we as dermatologists really need to wrap our head around it, because it prevents immune cells or lymphocytes from getting into skin. And this was a short study. It was only 12 weeks, and maybe 12 weeks is not enough to see the full action of this drug. And we see that also from the fact that at 12 weeks, there was not a plateau. So we see that still it was going up, and I think it's kind of an indirect mechanism of action. So I think at 16 weeks and further, we would see potentially better results. But the validated IgA, the VIGA so basically clear or almost clear, was significantly higher in patients on Etrasimod 2 milligram as compared to placebo, and it was around 30%. And I think these are hopeful results for such a small study. And also it was accompanied by significance in patient-related outcomes. And in atopic dermatitis, we care a lot about these because it's a very itchy disease that prevents patients from sleeping and doing their normal daily activities. So I think it's an important study that opens a new avenue of research and also for a potential treatment for our patients with moderate to severe atopic dermatitis. And I'm looking forward to the next steps. Hopefully there will be a phase 3 study that this company will do.